As of March 12, 2020, about 1,311 people in the United States have been confirmed to have the virus, though many others' cases may be undetected. Of those reported cases, 38 people have died, with 30 deaths in Washington, 4 in California, 2 in Florida, 1 in New Jersey and 1 in South Dakota. Globally, nearly 128,000 cases have been now confirmed, with 4,718 deaths. The death toll in Italy has jumped in the last 24 hours by 189 to 1,016, a rise of 23%, the Civil Protection Agency said on Thursday. The total number of cases in Italy, the European country hardest hit by the virus, rose to 15,113 from a previous 12,462, an increase of 21.7%. The World Health Organization declared the outbreak a pandemic as Italy tightened its strict quarantine and the U.S. imposed a ban on flights to Europe. So what is coronavirus disease 2019? Coronavirus disease 2019, also called COVID-19, is a respiratory illness that can spread from person to person. The virus that causes coronavirus is a novel virus that was first identified during an investigation into an outbreak in Wuhan, China. Can people in the U.S. get coronavirus? Yes. Everyone in any corner of the world can get coronavirus. Coronavirus is spreading from person to person in parts of the United States. Risk of infection with coronavirus is higher for people who are close contacts of someone known to have the virus, for example healthcare workers or household members. Other people at higher risk for infection are those who live in or have recently been in an area with ongoing spread of coronavirus. How does coronavirus spread? The virus that causes coronavirus probably emerged from an animal source, but is now spreading from person to person. The virus is thought to spread mainly between people who are in close contact with one another, usually within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. It also may be possible that a person can get coronavirus by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. What are the symptoms of coronavirus? Patients with coronavirus have had mild to severe respiratory illness with symptoms including fever, cough, shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. There can also be severe complications of the virus. Some patients have pneumonia in both lungs, multi-organ failure and in some cases death. So, how can you help protect yourself? People can help protect themselves from respiratory illness with everyday preventive actions. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. Wash your hands after touching surfaces in public places. Clean and disinfect your home to remove germs. Practice routine cleaning of frequently touched surfaces, for example, tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, and cell phones. Avoid crowds, especially in poorly ventilated spaces. Your risk of exposure to respiratory viruses like coronavirus may increase in crowded, closed-in settings with little air circulation if there are people in the crowd who are sick. Avoid all non-essential travel including plane trips, and especially avoid embarking on cruise ships. Avoid public areas. Do not go to work, school, or public areas. Avoid public transportation. Avoid using public transportation, ride-sharing, or taxis. Limit contact with pets and animals. You should restrict contact with pets and other animals while you are sick, just like you would around other people. Do not share stuff. You should not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people or pets in your home. If you are sick, to keep from spreading respiratory illness to others, you should call your healthcare provider and let them know about your symptoms. Tell them that you have or may have the coronavirus. This will help them take care of you and keep other people from getting infected or exposed. If you are not sick enough to be hospitalized, you can recover at home. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. You should wear a face mask when you are around other people. Who exactly is at higher risk of contracting coronavirus? Early information out of China shows that some people are at higher risk of getting very sick from this illness, including older adults, people who have serious chronic medical conditions like heart disease, diabetes, and lung disease. If an outbreak happens in your community, meaning a large number of people suddenly get sick, it could last for a very long time. What should I do if I recently traveled from an area with ongoing spread of coronavirus? If you have traveled from an affected area, there may be restrictions on your movements for up to 2 weeks. If you develop symptoms during that period including fever, cough, trouble breathing, seek medical advice. Call the office of your healthcare provider before you go and tell them about your travel and your symptoms. They will give you instructions on how to get care without exposing other people to your illness. While sick, avoid contact with people. Don't go out and delay any travel to reduce the possibility of spreading illness to others. Is there a vaccine or treatment? There is currently no vaccine to protect against coronavirus. The best way to prevent infection is to take everyday preventive actions, like avoiding close contact with people who are sick and washing your hands often. There is no specific antiviral treatment for coronavirus. People with coronavirus can seek medical care to help relieve symptoms. The CDC recommends that if you are at higher risk of getting very sick from coronavirus disease 2019, you should stock up on supplies, take everyday precautions to keep space between yourself and others. When you go out in public, keep away from others who are sick, limit close contact and wash your hands often, avoid crowds as much as possible. During a coronavirus outbreak in your community, stay home as much as possible to further reduce your risk of being exposed. Please, we recommend you to always consult your medical provider for any other symptoms that are severe or concerning. For more information about the virus, visit the website www.cdc.gov. Subscribe to this channel to receive updated news about the virus and other diseases to improve your health.